Good evening, everyone. Let's start with a prayer. Heavenly Father, we thank you this evening. Bless you for giving us the grace to come together to worship. We thank you for the health you're giving unto us. We understand that it's our responsibility to take charge of our health as well. We pray, God, that you help us as we listen this evening, for us to apply all that we learn in Jesus' name. Amen. As rightly introduced, Owolabi Emmanuel Abiodun, a foreign level medical student of BABCOCK University. Thank you. So I'm the founder of Eohealth, but the primary assignment this evening is to talk on a very pertinent issue. Now, we'll start this way. We'll start this way. I know most of us have phones, so that's right. We have our phones. Very good. Imagine your phone does not have any means to tell you that your battery is low. Imagine you're on a very busy work, on a very serious work, maybe your project, on your laptop, and your laptop does not have any way to tell you that your battery is low. And then at some point, the laptop just go off. Trips off. Then you're like, why? Okay, just like, the way we're used to in Nigeria. Let's say back home, you have a computer setup and you don't know that there's not any alarm that they're going to take lights. And then that is how the power gets interrupted. That's what happened most of the time when we are not aware of some major parts of our body that we have to actually take charge of. One of those parts of our body that are concerned, that we're talking today, the heart, the vascular system. But that's not even the target. The target is the topic itself. That common thing you hear, hypertension. So the topic that says, understanding hypertension, the silent killer. The choice of silent killer is very intentional. Let me share you a story. I think a few months, that was last year, but a few months ago, as a medical student, I was able to, go on call in booths and all of that. So there was this young guy, 21 years old, I can remember. The guy, this particular time, I was taking history, clinical history, and then he was groaning, he was seriously in pain. Like, please doctor, I really want to be out of here. And then, after taking my history, I found out that he had hypertension, 21 years old guy, had hypertension for like 4 months. Okay, he had tried his best to beat it down, but then he met it late. He was able to find out late after he started presenting some symptoms of swollen leg and then other parts of his body, and then he was not producing urine. That's when I realized I was having hypertension. It's indicating something there as clinicians, we know what it's indicating. But you wonder what a 21 years old boy or a guy, whatever I call it, is doing with hypertension, right? That's the concern. This person is not weighty, like slim person. Very young and agile. Guy could speak nice English, even if he was not in the educational system. Like, he was a promising person as a person. Like, talking with him, and then right before my eyes, I was almost crying. I shouldn't cry, of course. But then I was almost shedding tears, like, this is a promising person, but then he's losing his life. The whole scenario was that hypertension actually kills. Let me add this because I want you to see how serious this scenario is. Another story I'll paint to you is I lost a very close person, someone that actually looked after me. And then I think 4 or 5 years ago, this person died of a complication from hypertension. How did I know? I think last year, I asked my mom, okay, let's go back. So now I'm a medical student. Let's go back to what happened. What killed this person? And then he started narrating that actually he had been nursing hypertension for a prolonged period of time, but he didn't realize on time. But when he realized, it was late. It's a silent killer. Let's go. Okay, now let's look at the definition of hypertension. It's known as high blood pressure. It's a medical condition characterized by persistent elevated pressure in the arteries, which forces the heart to work harder to pump throughout the body. Hypertension itself is just identified by this reading you see. The upper one is, if you check this BP machine, The upper one is systolic. You can see 110, right? The lower part is diastolic, 69. Now, how you know you have high blood pressure is when the upper one, systolic, is more than 130, okay? And then the lower one, which is diastolic, is more than 80. That's when you know you have high blood pressure. But the fact that you have high blood pressure does not mean you have hypertension. Okay? Persistent, when it remains there for a long time, that is hypertension. Okay? So it's very, very possible. I mean, anyone, right now, many of us are stressed. If you pick out the machine and check out your blood pressure, I can bet that half of the persons here will have up to 130. You're surprised? Yes. So let's go to the next slide. Yeah, why maintain normal blood pressure? We've said this all this time. From definition, we said hypertension is when the blood is forcing the walls of your vessels. I mean, the blood is coming out from your heart and then through your vessels, then it's forcing itself. So wherever the vessels are supplying, could be your brain, could be your eyes, could be your kidneys, could be anywhere. So when the blood is forcing its way through, then there's hypertension. You know, there's this, sorry for Yoruba people, maybe you don't understand. You must have heard of this common saying, Adake Foju, glaucoma. Glaucoma is called Adake Foju. In English, you can interpret it as silent blinder. Do you understand? It blinds the eyes. Glaucoma, you know you have glaucoma, but what is prominent about it is increased ocular pressure. Same thing, when there's persistent hypertension on the vessels to the eye. Do you understand? So it can be anywhere in the body that the vessel is supplying. When blood is forcing itself through, what could happen could be because of a blockage. Maybe the vessels are getting thickened, like maybe fat or anything could have resulted to that. Now, epidemiology, why are we talking about hypertension? You see our problem, we are young, like we still have time, we can still have fun. I just told you about a scenario, a case study to look at. Surprisingly, in BABCOCK University, one lecturer told us that a survey was conducted that over 40% of students in BABCOCK University have high blood pressure. You surprised? Yes. It's like that. I mean, there could have been many scenarios that could have added to that, maybe stress and other things could have added to that. But regardless of that, there's a statistics that 1/3 of adults, okay, suffer from this disease, and over 30% of adult population in Nigeria statistically suffer from this disease. However, hypertension does not have a particular age where it affects people. I mean, unlike some cancers some things will have happened before something will not finally happen. Do you get? Hypertension can just take like a year and kill, 2 years and kill. So what we're saying is that high blood pressure can occur in any range of ages. Okay, it can happen anytime. Okay, but it increases with age, and there are many factors to that. You know, the older you become, probably living sedentary lifestyles. You're not going out. You are using cars. I mean, you're going from office to office. You just sit down somewhere. You're getting. Do you understand what I'm saying? But while you are young, you can still exercise. You can still run here and there. Maybe these are things that prevent your occurrences. But it doesn't mean that it cannot happen if you put yourself to the scenarios that other people are putting themselves into. Do you understand now? So that is one concern. So let's go next. So risk factors, like I said, we have genetics. So in hypertension, there are essential hypertension. That is, doctors will just check you. I mean, check a patient and then find out the patient has hypertension, but there's no particular pointer to do. I mean, there's no particular cause of the hypertension. Okay? Some can be idiopathic, that is what we call no particular cause. And then sometimes they are just there because maybe person's genetics makes it like that. Okay? And then lifestyle choices. Okay? Lifestyle choices, poor dietary intake. See, like I was saying earlier, I'm dwelling on this part, I'm taking it slowly so we can absorb it. Okay? I said earlier that we have essential and we have secondary. Okay? Now, for secondary hypertension, these are modifiable factors of hypertension. Secondary means something that affects maybe external, right? Primary is within, right? So now, secondary factors are factors that can prone to hypertension, but you can control. Okay, your poor dietary choices. Okay, so poor dietary choices will lead to hypertension sometimes. Lack of physical activity. Of course, you can decide to do physical activities. Okay, so these are modifiable choice factors. Excessive alcohol intake. Okay, or consumption. These are reasons why people go into hypertension as well. And tobacco use. You wonder how all this costs, right? All these things, you don't have the time now, but then over time, they metabolically allow fats to stay in some of the vessels that supply some of our body, some organs, or even the heart, and then it causes hypertension. There are environmental factors as well. Sometimes there is this particular heart problem, heart attack, that happens in Africa. I mean, some people say that once it happens in Africa, I mean, that is the end. The reason is that there is enough health facility to address that issue. So most of the time, sometimes the environmental factors can be the health facilities that are available are not enough to have been addressed easily. I classified some factors as very, very key factors for us youth, okay, that we can address to prevent, as factors, and then also, of course, we can use them as a means to prevent hypertension. One of those factors is stress. Stress, okay, chronic stress. That is when you keep putting yourself under pressure, under stress for a long period of time. No rest, no sleep. Your body is not having time to run the way it's meant to run. Okay, it will lead to hypertension and obesity. That is another very important factor. Okay, you have to check. Of course, I think I'm aware that on Friday there will be a vital check and then BMI and all of that. So it's very important that you know your BMI, you know your weight, you know where you belong, whether you're obese and whether you need to correct it or not. So and then smoking as well is very prominent amongst youth, amongst people, whether the secondary smoker or the primary smoker, is very, very important. You have to be very intentional of avoiding this factor. And then physical inactivity is another factor that you have to be very intentional about. I mean, sometimes it's very, I won't say tempting, but there is tendency that when you are going to class in the morning, you want to use keke and other means of transport. Even after class, you still use means of transport to convey yourself to your hall or wherever you are going to. Be intentional about actually putting yourself through some physical activities so that you can be able to prevent this particular disease. Salt consumption. Now, this is one part that is very, very important that you have to take note of. Salt in itself, okay, when it's in the body, can accumulate and draw water to itself. So, and physiologically, that will increase the blood pressure, okay? So, when you now consume extra salts, you add more salt to yourself and then it goes beyond where it's meant to be. Now, you wonder how a lot of what you consume, fast food, okay, they contain salt, okay? So, you have to be intentional about cutting down your salt intake. And there's no way you cut your fast food and remove the salt. So you have to actually limit their consumptions. Prevention, of course, all the factors that I said earlier, doing away with them simply means their prevention. So I said earlier that preventions are preventing those factors, so we are done with that. So complications of hypertension. So let's see what are the things that hypertension can cause. Okay, how does hypertension result to why is it a concern? Okay, one of the things it causes is atherosclerosis. This condition, okay, is a result of buildup of plaques in the arteries. Plaques are what makes the arterial walls to get thick like fat. Okay, I said earlier that when blood is trying to force itself through a vessel, okay, and then the means by going through keeps reducing, okay, can be a result of plaques. So atherosclerosis happens when there's hypertension. You know, it's interwoven, but let's not go into that. Atherosclerosis is a very dangerous thing because atherosclerosis can lead to other heart disease. Okay, so It's one thing you want to run away from. Then heart disease itself, several of them. Chronic hypertension puts added strain on the heart, okay, causing it to work harder to pump throughout the blood. Let me make it mechanical to you, something you can imagine. When something is forcing itself to pump blood out, it will require more energy, right? So when it works beyond the way it's meant to work, that is the earlier it will die. So that is just like the engine that is running, and then it's overusing the engine. That's what happens to the heart. Can either become bigger than normal or all of that. So then stroke. This is very common. Sometimes we hear of scenarios where some people go to night parties, and then the person just drops down, and then that's the end, dead. Wonder, nobody killed, nobody shot, and then sometimes want to attach it or connect it back to people at the village. Not really. Sometimes it's stroke, okay, and maybe a lot of hypertension. There was a scenario of someone that was just selling something, and selling these food stuffs. Then just like that, the person just came down on the floor and then dead. Just like that, stroke. So stroke has different types. Very different types of stroke. But what is important here is that stroke is a cerebrovascular disease. Okay, it's a very cerebrovascular accident. It's an accident. It just happened. So what is prominent about stroke is that hypertension, like I said earlier, the blood is forcing itself, trying to go through the vessel. So in the brain, when the blood forces itself through the vessels of the brain, and then at some point the vessels become bigger, and then it bursts. Do you understand? So the bursting of the vessel, okay, that's what we call hemorrhagic stroke. So it leads to other, I said cerebrovascular, Abi. Now, the vascular part, you understand, Abi? The vessel bursts. And the cerebral part is the blood that is leaving the vessel, that is entering the environment of the brain, will now start affecting the function of that part of the brain. Do you understand? So that is cerebrovascular. So the hemorrhage, the breaking of the vessel, stopping the function of the part of the brain that is affected. So that is stroke. So if a part of the brain that is controlling the hand, the right hand, is affected, the person will have what's it called now? Stroke, okay? The partial stroke or whatever. So renal failure. I give an example of this the other time. Renal failure as well. The same thing, the organ that is very important for filtering waste products. Once that organ is gone, it is very difficult to live, okay, except there's a transplant, a renewal. And the next one, okay, now this particular one now, I said earlier from the start, I'll read from here. Many individuals with high blood pressure may not experience any noticeable symptoms, leading them to underestimate the seriousness of the condition. There was a time that one of my family members came to our house, and then she said, Emmanuel, when they know you are a medical student most of the time, they just come to you and turn you to the doctor, And then Emmanuel, my leg is paining me, said she feels pain at her heel. And then I was like, when you sit down for a long time and you stand, do you feel numbness in your leg? And she said yes. And I asked her, when did you check your blood pressure? She was surprised. And I brought out my BP machine, checked her, and behold, she was having high blood pressure. I gave her a particular supplement, and then the next morning she called me and started praying for me. So what I'm trying to say is that most of the time we don't know, okay? And because of this, anywhere the vessel is meant to supply, carry blood to, if it's affected, okay, it's because of damage. Luckily, this was just our limbs. What if it was our kidney? Do you understand? So most of the time we don't know, and then we just live like that. So, however, just because hypertension isn't causing noticeable symptoms, doesn't mean it isn't causing damage internally. Like I said about the eyes the other time, okay? You will know that something is going on in your eyes, and then that's how this keeps deteriorating. So left untreated, hypertension can easily damage blood vessels, organs, and tissues throughout the body, increasing the risk of serious complications such as heart disease, stroke, and kidney disease failure. Therefore, regular blood pressure, okay, monitoring and early intervention are crucial for preventing and managing hypertension-related complications. You have to check your blood pressure. Tell your friend you have to check your blood pressure. Okay, so don't see it as daddy and mommy thing. Don't see it as for the elderly. Do you get? When your parents have, some of our parents have BP machine, go there to check. Not like, you have to do it, be intentional about it, but check it regularly. That is very important. When you check regularly, it helps you to detect your health state. Okay, that's a very good pointer to your health state, your health condition. And so the management, okay, you can have a list of management. Like I said, the preventive measures that you have are also one of the ways to manage hypertension. Okay, if peradventure you are already in that state or that condition where you have hypertension, don't fidget. Just do well to manage hypertension, to bring it back to the normal. And so very important, your basal level or your blood pressure normal level might be different from another person's own. Do you understand? The fact that you have to understand, when you have to know it yourself, your normal blood pressure at a particular time. For example, if mine is 110/80, okay, and then at some point it goes to 120/80, I will know there's a change. Is there something that is different? Do you understand? Once someone's one is 125/80, okay, and then you check for the person, you're almost pre-hypertensive. Do you understand? You cannot use yours to judge. However, there is a range for everybody, okay, but sometimes there can be deviation. Usually, it is when you are above 130 and 80 that you can now start fidgeting, or not necessarily fidgeting, just go to your doctor and do a proper checkup. Do you understand? So medications that you use are these medications. We don't need to know them by their names, but the important thing is that when you're using these medications, you have to adhere to them. Okay, one thing about medications, let me look at my time. Sorry. So, what about hypertensive drugs? Antihypertensive drug is that once you start using them, you will most likely continue using them. Okay, because that becomes one of the things that your heart will have to depend on. Okay. However, before you advance to using drugs, that means all other means of treating or managing it as refuse to work. Do you understand? Do you understand? If you happen to fall into a scenario where probably when you check on Friday and then you have to check again and then realize that there's a reason for you to monitor your blood pressure or manage it, you have to first go through, your doctors probably know all these things, go through the other factors, except there is a pathology, except there's a disease somewhere that has to be managed. Do you understand? To control the hypertension. But if it's just a normal hypertension, an essential hypertension, you have to first address factors like maybe your exercise more, reduce your weight, other things that can lead to hypertension before going to drugs. Because once you go to drugs, there's most likely no stopping. And then you have to adhere to the drugs. Conclusion. Understanding and managing hypertension is vital for maintaining optimal health and reducing the risk of serious complications. By taking proactive steps, such as adopting a healthy lifestyle, attending regular checkups, like the one you will all come on Friday. I wish I would say everybody on Friday. Yeah? So, and adhering to treatment plans, individuals can take control of their health and prevent its potential devastating consequences of uncontrolled hypertension. Remember, knowledge is power, and by staying informed and proactive, we can empower ourselves to lead healthier lives. Take charge of your health starting today.